health care. Last week, Senate Finance Committee passed a bill to reduce the prices of prescription drugs and save taxpayers billions of dollars on government-run health care programs. Iowa Senator Charles Grassley co-signed that bill and joins us this morning. Good morning, Senator. Thank you for waking up early with us.
Glad to be with you, and you described your bill very well. It's kind of unusual to get a bipartisan bill that saves a little more than $100 billion of taxpayers' money, and it also is a reform of an entitlement program, which is very difficult to get done here in Washington. It will cap out-of-pocket expenses for seniors. It will even affect some reduction in the commercial insurance market, and it won't increase co-pays or co-premiums. And overall, it's a very good thing for seniors and entitlement reform and saving the taxpayers $100 billion.
Now, Senator, we know that this was a bill years in the making, and as mentioned before, health care was a major topic of discussion during last night's debate. What was your reaction from that conversation and your takeaways from that as well?
Yeah, you know what? The cloakroom, we had 12 votes last night until 10 o'clock, and the cloakroom was full of Republicans watching the debate and commenting on it, but I didn't pay any attention to it, and just didn't, so I'm not able to answer your question.
That's okay. Well, I think you may be able to answer this next one. In terms of important moves for healthcare in this country going forward, what's the next step?
Well, I think the next step is, first of all, we've got to stop this effort that you heard was talked about last night in the debate. I know they were talking about Medicare for All, which does away with all employer-sponsored insurance. The government's going to run everything. It's socialized medicine. So at least one thing that Democrats in their debate are admitting, that Obamacare isn't working. So I think the best thing for the publics to remember, if there's any changes at all, and I don't expect a lot of changes in the near future, but we're going to protect pre-existing conditions. That's the number one goal that we have to protect. Otherwise, we're going to move ahead on the bill that you and I have already discussed out of the committee I chair, dealing with Medicare and Medicaid. And then there's another health committee in the Senate under Senator Alexander. There's a bipartisan bill moving there that's going to bring more transparency and get generic drugs on the market faster. So we're going to have a Republican program out of the Senate to reduce costs, which in turn will reduce health premium costs.
All right, Senator Grassley, thank you for your time this morning. Really appreciate it.